threat. And joining me right now to talk about outreach, particularly to pregnant women of childbearing age, is Dr. Deborah Feldman, who specializes in high-risk pregnancies at Hartford Hospital. Appreciate your time so much.
Thank you.
All right, so many worries for women given the birth defects that the Zika virus can cause. Are you hearing from women with questions? I would assume a lot.
We are, pretty much every day. We hear from women that we see on a daily basis. We also hear from our OB providers who refer to us, how best to screen these patients, how best to test these patients, who to test. So we get a lot of questions about Zika.
And what are you guys doing about outreach right now? You're certainly on the front lines of this. Are you educating women at the same time?
Yes, our outreach involves education and also questioning patients each time they come in, and that's what we're recommending for our OB providers. At every prenatal visit, we recommend that they screen them for recent travel, possibly Zika-related travel, education against travel to these areas, so we can best prevent it in the first place.
And I'm sure there's a lot of questions for women who are of childbearing age and might want to get pregnant in a year or 6 months. What are you recommending to them? Are you saying don't go down to the Caribbean or Mexico at this point?
Yeah, that's a little tougher. If they're planning pregnancy, I think we don't really know the timing in terms of Zika virus and then becoming pregnant, what the risks are. Certainly they're likely less than having Zika infection while they're pregnant. Mm-hmm. We're certainly not recommending avoiding pregnancy until the epidemic goes away, like they are in Brazil. So it's a little bit tricky. I think that if a patient knows or she's actively trying to get pregnant or knows she's going to be within the next few weeks to months, then we're recommending avoiding Zika-related travel.
And you have one for men also, right?
Yeah, the recommendation for men actually is for documented cases of Zika virus that they don't actively try to procreate for 6 months after the infection.
All right, that's kind of a long time.
Yeah.
No mosquitoes have been found here in Connecticut, but what should women do to protect themselves just in case?
Well, I think the best prevention against Zika is prevention against mosquito bites. So, we would still recommend insecticides and, wearing long sleeves, long pants to avoid mosquito bites, staying in the air conditioning, just avoiding mosquito bites in general.
All right, Dr. Deborah Feldman from Hartford Hospital, really appreciate your time. Good tips and good information there.
Thanks for having me.
All right, Brent.